Reasonable adjustments in hospital are helpful changes to the way the hospital works with someone with a learning disability. Reasonable adjustments mean people with a learning disability can get the treatment and healthcare they need. Some people might think these adjustments are big, expensive and complicated things that are hard for doctors and nurses to do. But really, what we are asking for is only reasonable. Whenever Rachel goes into hospital for an operation, the doctors and nurses often use complicated medical jargon when talking to her about her treatment. She is not asking them to stay up all night learning a completely new language. That would not be reasonable. She's just asking the hospital doctors and nurses to use simple words when they are talking to her. This is a reasonable adjustment. Ben needs more time with his doctor to explain how he is feeling when he is unwell, otherwise he feels rushed. He's not asking to go on holiday to Disneyland with his doctor. That would not be reasonable. He's just asking for a bit more time, perhaps a double appointment. This is a reasonable adjustment. When Maria goes to hospital in an emergency, she gets very upset and stressed if the waiting room is noisy and full of people. She is not asking for a whole new hospital to be built just for her. That would not be reasonable. She is just asking that the staff find a quiet place where Maria can wait to see the doctor. This is a reasonable adjustment. Vernon doesn't like having to explain everything about his health conditions every time he sees a new doctor. He's not asking for every doctor in the hospital to know his medical notes off by heart. That would not be reasonable. He's just asking that every doctor or nurse who treats him reads the information in his hospital passport. This is a reasonable adjustment. These adjustments are reasonable, aren't they?